and then expose you to dangerous diseases are by a puncture wound with a contaminated instrument, by a puncture wound with a contaminated needle, from contact of contaminated blood or saliva with an ungloved hand that has broken skin, from failure to handle biohazardous waste properly, by the splattering of contaminated blood or saliva into the eyes while failing to wear protective eyewear, or by the splattering of contaminated blood or saliva into the nose or mouth while failing to wear a mask. Remove unnecessary items from the treatment room. The fewer things contaminated, the easier the cleanup. Plan materials needed for treatment. This will eliminate the need for you having to get things after your gloves are contaminated. Use disposable items whenever possible. This will leave you with fewer things to clean and disinfect. Use prearranged tray setups to eliminate forgotten items. Use sterilizable burr blocks to make cleanup easier. Use a rubber dam when possible to cut down on aerosol contamination. Leave the patient chart out of the treatment room to keep it from getting splattered. Review it prior to treatment and make notes following treatment.
Dispose of wipes, gloves and mask. Remove protective glasses and wash hands. To reinforce the importance of changeover cleaning, the following is a checklist. Purge lines for 30 seconds. Run 500 ml of water through suction lines. Soak disposable wipes with neutral detergent solution and clean from least contaminated surface to the most contaminated. Ensure that all surfaces are wiped, including bench tops, operator, assistant and patient chairs, operating light and X-ray unit if present, bracket tray and table, handpieces including triplex and ultrasonic instruments, brackets and tubing, suction handpieces, brackets and tubing. At the end of each day, a final clean is done. Remember that a changeover cleaning should have been performed after the last patient of the day. Use heavy-duty gloves, mask and protective glasses. Flush the suction lines with the recommended solution per unit and clean the filters.
This is a sterilization center here at Roselle Dental, where we clean and sterilize all our instruments for patient use. We are proud of the fact that we either meet or exceed the standards set by the CDC guidelines and OSHA. Let's take a look at the steps we take when we process and clean these instruments.
Our sterilization process starts with taking the contaminated instruments and putting them in a basket. That basket is then placed into an ultrasonic cleaner. Once that ultrasonic machine has run its cycle, then we rinse the instruments and we place the cassette in a dryer. Once the drying cycle has been completed, the basket is then removed and the instruments are placed into a sterilization bag. Those instruments which are in the bags are now placed into an autoclave, which is the actual sterilizing unit. Once the autoclave cycle has been completed, those instruments that are now sterilized in the pouches have an indicator on there showing that the sterilization has been completed.
This video follows the NHS guide to hand washing with soap and water. Step 1. Wet your hands with water. Step 2. Apply enough soap to cover all hand surfaces. Step 3. Rub your hands palm to palm. Step 4. rub the back of each hand with the palm of the other hand with your fingers interlaced. Step 5. Rub palm to palm with your fingers interlaced. Step 6. Rub with the back of your fingers to opposing palms with your fingers interlocked. Step 7. Rub each thumb clasped in an opposite hand using a rotational movement. Step 8. Rub the tips of your fingers in the opposite palm in a circular motion. Step 9. Rub each wrist with the opposite hand. Step 10. Rinse your hands with water. Step 11. Use your elbow to turn off the tap. Step 12. Dry thoroughly with a single-use towel. Hand washing should take 15 to 30 seconds.